Let's discuss about an autoimmune disorder called type 1 autoimmune diabetes mellitus. And this is we all know that diabetes mellitus has two types, type 1 and type 2. And type 1 is an autoimmune condition. It is a more severe form of diabetes. It is a condition where there is no insulin resistance is seen, but macrovascular complications are also not seen. And microvascular complication always set in after the development of the disease. And in this condition, no environmental factors have been environmental factors have no role, but genetic factors have a very role and has an association with the HLA. And clinical features always goes in the stages like normoglycemic. Patient first become normoglycemic, then dysglycemic, and then hypoglycemic. Set in three stages like normoglycemic and dysglycemic. And later on, the disease, full-fledged disease often develops when there is 70% of the destruction of the beta cells of pancreas. And let's know about the antibodies which are implicated in the autoimmune disorder. So antibodies often implicated are the anti-islet cell antibodies, anti-insulin antibodies, and also antibodies against zinc transporter, antibodies against glutamic acid decarboxylase, and antibodies against tyrosine pyrophosphate. And this tyrosine phosphate autoantibodies are mainly are high in the case of insulinoma. So when a patient is suffering from insulinoma, high titers of anti-tyrosine phosphate antibodies are seen. And let's discuss about the investigations which help in the diagnosis. We all know that insulin release is accompanied by the release of C-peptide. Hence, low level of C-peptide indicates that there is low level of insulin. So, estimation of the C-peptide levels will help in the diagnosis of this condition. And also I said there are many antibodies which are implicated, autoantibodies, as I already discussed, like islet cell antibodies, insulin antibodies, and antibodies against zinc transporter, antibodies against tyrosine phosphate, antibodies against glutamic acid decarboxylase. All these autoantibodies estimation also helps in diagnosis. And also let's discuss about the clinical features seen in case of type 1 diabetes mellitus. And the clinical features mainly include like polyuria, polydipsia, polyphagia because of osmotic diuresis, and also patient will be in a patient will have a dehydrated appearance, and also there will be low glucose production, and also increased gluconeogenesis will be seen. As there is low level of insulin, there will be activation of the hormone sensitive lipase, and this is responsible for the lipolysis and also increased gluconeogenesis. Because of the high gluconeogenesis, patient will end up into diabetic ketoacidosis. And also patient will have fatigue, weakness, and also poor resistance to combat with the infections. And also there will be metabolic acidosis. And this metabolic acidosis will finally leading into hyperventilation and also leading into the Kussmaul type of breathing. And all these clinical features will be seen, and there are more chances for diabetic ketoacidosis. We all know that there is high amount of hyperglycemic patient, and this diabetic ketoacidosis patient often presents with pain abdomen, metabolic acidosis, and other features. And some of the features also associated with type 1 diabetes mellitus like PCOS, but in this condition there is no acanthosis nigrans, and also other hyperdyslipidemia conditions. All this also will be seen in case of type 1 autoimmune diabetes mellitus. And also insulinitis is also the condition which is associated with type 1 diabetes mellitus, and as I already mentioned in the earlier itself that it has a high HLA association. And let's discuss about the treatment. The main thing in the disease is that there is low insulin level. So giving the insulin is the mainstay of treatment, and also patient has dehydrated features because of osmotic diuresis, hence the hydration has to be corrected. And we all know that there are many types of insulin like short acting, long acting, intermediate acting, ultra long acting types of insulin, and all these types depending upon the need can be utilized in these patients. And this is all about type 1 autoimmune diabetes mellitus, and this may be associated with other autoimmune disorders also. And thank you for watching.